Hello, everyone, and welcome to this month's Heart Bunch video. We are so excited today to be talking with you about how to avoid using stigmatizing language, particularly in recovery and for people with substance use disorder. Really, what we want to communicate today is that stigmatizing language can hinder people from getting the treatment and going into recovery that they might need for their substance use disorder and their mental health treatment. So we want to give you some ways to rephrase different terms and why this is so important as a concept. And we can start to think about how people are strong and enable them to do the things that they need to do for their treatment and recovery instead of using words that might get in the way of that, or hinder them, or label them as weak or something that we don't intentionally mean to say sometimes. Stigmatizing language can also negatively influence how healthcare providers view people, how other people view people going through treatment. So we want to be really cautious with our language. And this is true for people ranging in the education system, medical providers, family members, because each of us are an important role on that path to recovery for individuals. And we can all lead by example by using affirmative person-first language. And that's something that we're going to just start with. And I'm going to kick us off by talking about how to use person-first language. This is a really important skill because instead of calling the person by their disease, because we don't call somebody, oh, that diabetic, right? Instead, we say that person has diabetes. And so we use the person first to say this person is more than their medical condition or their disease. So instead of saying a substance abuser, we would then say, which is a more appropriate term, a person with a substance use disorder. And that would be much more appropriate because you can see the person is first. You also might want to talk about somebody being diagnosed with a certain condition, right? Like that diabetes example that I gave, a person with diabetes instead of that person is suffering from or a victim of diabetes, which doesn't even make sense in this context. But we use that all the time for substance use disorders. So instead of saying something like that, replace it with a person who is diagnosed with alcohol use disorder or opioid use disorder or something like that, right? So make sure that you're watching that language. And you can also just use, again, that person who maybe in the past somebody called a drunk or crazy or some of those really harmful terms. You can replace that with a person with alcohol use disorder or a person who needs treatment or is diagnosed with depression, right? So just having that person first can make a really big difference. And I'm going to pass it over to Matea.
Thanks, Ashley. I'm just going to talk about the use of accurate labels for a condition. So I would encourage you to use the word or the term substance use disorder as opposed to using words like drug habit or drug problem. Using these words, habits, problems, in this context really inaccurately implies that a person is choosing to use substances or that they can choose to stop. It also really undermines the seriousness of the disease and puts blame back on that individual. So keep in mind, kind of like what Ashley was mentioning, that substance use disorder is a chronic, treatable disease that people can recover from. So we should really be communicating about it in the same way that we would talk about people with other chronic diseases, such as people who've been diagnosed with diabetes, heart disease, or cancer. So Tim, I'm going to pass it over to you.
Thank you, Matea. Yes, I want to talk a little bit about avoiding using the term abuse. We talk about that has been shown to show a high association with negative judgment and punishment. Some examples of reduced stigmatizing language involving abuse includes for illicit drug abuse, replaced with illicit drug use. For prescription abuse, replaced with prescription misuse or use other than prescribed. Drug abuse can be replaced with drug misuse or harmful use. A drug abuser replaced with person with a substance use disorder or SUD. It's not about being sensitive or polite or politically correct. It's about access to quality treatment and care. And first person language helps with that and make sure that we take good precautions with those that we know may need some additional support going through their treatment or through whatever they might be going through in their lifetimes. So changing our language is a crucial component for reducing stigma to improve the lives and health of people who use drugs or alcohol and for people with substance use disorders. I'm going to now turn the time over to Rachel.
Thanks, Tim. Another tip that I'm going to talk about is using clinically accurate terminology like you would for any medical condition. So, for example, using the term recovery instead of saying that someone is clean or reformed. So, for example, you could say that a person is currently in recovery. In addition, using terms like relapse connotes all or nothing thinking and implies that any substance use equals a loss of control. For example, you could say that a person experienced a recurrence or resumed a given behavior. I'm going to turn it over for the next tip.
Just like Rachel was saying, just trying to avoid using the word relapse. It does kind of imply that if a person uh, is using or has used a substance in the past, that any little bit that they use again means that it's an all or nothing, means that they're back down that path, and that's not the case. So for example, someone who may not drink alcohol anymore, they might have a drink and then they go back to not drinking ever again. So avoiding something like relapse, just because it does connote that all or nothing. So you say something that the person has experienced a reoccurrence, or they've resumed a certain behavior, is a better way to describe what that person is experiencing. So I'm going to turn the last tip over to Marin.
I'm going to talk about using proper terminology for treatment and therapy. So, there are some amazing medications that can treat substance use disorders that have been developed. And a lot like insulin treats diabetes. And so these medications are a valid treatment. In the past, they've been called sometimes a replacement therapy. And that implies that this medication is substituting for the substance that was being used. And we want to avoid doing that because these are valid treatments. For a little while, they were called medication assisted treatment, but recently, the Substance Abuse and Mental Health Services Administration has recommended replacing that term with medications for opioid use disorder. So the medication assisted treatment was called MAT, and that implied that the medication played a secondary role to some of the other approaches. Whereas when we use medications for opioid use disorder, MOUD, that's going to reinforce the idea that the medication is its own form of treatment, and it's just as valid as any other type of treatment that would be available. And so I also want to point out that just like that recent change from MAT to MOUD, as we talk about destigmatizing the language, just points out that it's an ongoing process and that this language changing as we constantly try to be sensitive and to reinforce the empowering nature of treatment and recovery for people.
Thanks, Marin. Awesome. We hope that this has been helpful for you all to learn some new phrases and understand that this is an ongoing process that requires updates as we go, and that we can really advocate for people and use this language to empower those that need treatment or support at this time. Thank you again for being with us today. Here are some of our contact information and our extension.usu.edu/heart. We have some great rack cards there if you want to see more about stigmatizing language reduction as well. And here are some brief references for your convenience. Thanks, everybody.